tax break. Mr. Secretary, under the bill, who gets the most benefits? A billionaire with a complex tax return or a working parent with one W-2?
Under President Trump's first term, a greater...
Not the first term.
Well,
I'm asking under this bill.
Including this bill, in terms of percent, as opposed to absolute numbers, in terms of percent, working families will have a greater...
Well, in fact, Mr. Secretary, every credible outside estimator says that the wealthiest win under this proposal and working people and the poor lose. They pay more. Working people pay more.
What began as a routine budget hearing quickly turned into a sharp interrogation over who really benefits from Washington's latest tax and spending proposal and who pays the price. If you are new here, subscribe now, because we focus on what these exchanges actually mean for working families, not just the political back and forth.
Thank you, Chairman Smith, and to the ranking member. Mr. Secretary, good afternoon. Does taking health care away from 16 million Americans lower prices for working families, yes or no?
I'm not sure what that question means.
The bill, the big, beautiful bill that was passed by this committee and the majority of the Republicans in the House would eliminate health care for 16 million Americans. I'm asking, does that lower the cost for working families, yes or no?
Again, which cost? Oil, fuel cost, food cost?
Household cost.
Sorry?
The cost that households have to cover every month. Middle class working people.
Again, I disagree with the characterization.
So the answer is no. The bill doesn't deal with that.
Well,
can you name one rural community whose hospital will be strengthened by this one big, beautiful bill? Just one, yes or no?
Again, I'm not HHS, but I will be happy to get to you on that.
I would appreciate that answer. 16 million people stand to lose health care. That's thousands of hospitals that will be affected. We're talking about jobs and families that will be impacted. Worse, we're dealing with these tariffs, which are taxes that Americans pay, which are raising the cost on medical equipment, putting further strain on rural hospitals in my district, but yet the billionaires under this plan will still get their tax break. Mr. Secretary, under the bill, who gets the most benefits? A billionaire with a complex tax return or a working parent with one W-2?
Under President Trump's first term, a greater...
Not the first term.
Well,
I'm asking under this bill.
Including this bill, in terms of percent, as opposed to absolute numbers, in terms of percent, working families will have a greater...
Well, in fact,
increase.
Mr. Secretary, every credible outside estimator says that the wealthiest win under this proposal and working people and the poor lose. They pay more. Working people pay more. That's the story of this big, beautiful bill. Help the ultra-rich and leave everyone else paying the price. Are you yourself a beneficiary of any provision in this bill? Will you personally receive a tax cut under the provisions of under this bill?
Two things, Congressman.
Yes or no? It's a simple...
We had a referendum on November 5th, and
Mr.
working
Secretary,
Americans
yes or
voted
no?
for President
Reclaiming
Trump.
my time.
And
reclaiming my time, Mr. Chairman.
And two,
Mr. Chairman, I'm reclaiming my time.
And two...
So, Mr. Secretary, it's my time, Mr. Secretary. I'm asking you a yes or no question.
I'm trying to answer you. And
it's a yes or no question.
Saying it louder does not elicit an answer.
Well, not answering the question at all proves that you're evasive. Are you the head, the person that's the head of overseeing the implementation of our tax code, a beneficiary under the provisions of, any provisions of this bill?
Again, this is an extension of an existing bill.
So are you a beneficiary?
This is an extension.
Okay, I will take that as a no. Mr. Secretary, did the TCJA help increase the supply of housing? Yes or no?
Sorry?
Did the TCJA help increase the supply of housing? Yes or no?
I don't know. And
according to the Federal Reserve of Philadelphia, comparing the pre- and post-TCJA housing market, they found that between January of 2015 to October of 2019, housing construction, in fact, slowed under TCJA. So, Mr. Secretary, do tariffs on steel, aluminum, and lumber raise the cost of construction? Yes or no?
Again, on the housing point, the interest rates went up because the economy was stronger.
And under this proposal,
inflation was nascent.
and under a budget report that just came out from the Yale Budget Lab, they just released data showing that because of the debt that is going to be added by this big ugly bill, mortgage rates will increase. Are you aware of that?
I'm aware that
This bill is a
I'm aware that the
disaster
Inflation
for the
Reduction
people
Act,
of Nevada
which I guess you
who are
voted for.
struggling with the cost of rent and the ability to afford housing. These are the pressing issues that my constituents are concerned about, and I hope that this administration understands the impact of the negative consequences of their proposal.
This administration very
I
much
yield
understands
back.
the impacts on working Americans, and that's why working Americans voted for President Trump.
Congressman Steven Horsford of Nevada pressed Treasury Secretary Scott Bessent with a series of direct questions that cut to the heart of everyday economic anxiety. Horsford asked a simple question that millions of Americans are asking themselves. Does this bill lower the cost of living for working families? Not abstract growth projections, not Wall Street confidence, but the cost of food, fuel, housing, and household bills that arrive every single month. Bessent repeatedly declined to give a clear answer. When pressed, he acknowledged the bill does not directly address those costs. That moment matters because it highlights a disconnect between how economic policy is sold and how it is actually felt at the kitchen table. Subscribe if you want these moments broken down without the spin. Horsford then shifted to healthcare, particularly in rural communities. He asked whether even one rural hospital would be strengthened by the legislation. Again, no direct answer. The concern is not theoretical. Independent estimates suggest as many as 16 million Americans could lose healthcare coverage under the proposal. That does not just affect patients, it affects hospitals, local jobs, and entire rural economies that rely on medical centers as major employers. Layered on top of that is the impact of tariffs. Horsford pointed out that tariffs function as taxes paid by American consumers, raising the cost of medical equipment and supplies. For rural hospitals already operating on thin margins, higher costs can be the difference between staying open and shutting down. If this kind of policy impact matters to you, subscribe so you do not miss our deeper coverage. The exchange ended with a familiar divide. Horsford warned that the proposal risks increasing costs for working Americans while delivering outsized benefits to the ultra-wealthy. Bessent responded by pointing to the election, arguing that voters endorsed the administration's economic approach. What this moment revealed is larger than one hearing. It shows how economic success can be measured in very different ways. For some, it is markets and macroeconomic indicators. For others, it is whether families can afford health care, housing, and basic necessities. Understanding that difference is essential to understanding the economic debate shaping the country right now.